All right. Hello. My name is Courtney Van Housen. I am one of the team members applying for the ACCC Innovator Award. I wanted to attach this video with the goal of showing everyone our outpatient questionnaire system that we're hoping to utilize to better closely monitor patients once they discharge from the hospital in their ramp-up initiation of BiTE therapy. So we reached out to EquiCare, which is our third-party patient portal software that we use here at the Cowell Family Cancer Center. All patients upon referral to our cancer center are offered the opportunity to look at labs, etc., through the patient portal. And so this invitation can be sent to their mobile phones or to their home, emails, and can be accessible through home computers. A lot of patients utilize this service, and so we were hoping to create a questionnaire or survey system that patients could easily access at home that would essentially screen them for any signs or symptoms of cytokine release syndrome or ICANS while they're at home, whether that's transitioning in that from inpatient ramp up to outpatient subsequent cycles or just subsequent cycles in general. We know that sometimes CRS and ICANS can be delayed in its presentation. And so we were hoping that with utilizing this daily questionnaire with patients, we'd be able to catch symptoms earlier and hopefully proactively manage them and keep them out of the ER unnecessarily. So I just wanted to share my screen with you guys today and show you guys a little bit about what we created. So hopefully you're able to see my screen and follow along. So this is kind of the homepage in terms of our Munson EquiCare from an admin perspective, right? So from a provider perspective. So what I have been able to do is create a work list that will show all of our patients who are active on a BiTE therapy. And so they'll be once they are on a BiTE therapy, they will show up on this list. And then what I can do is go into individual patients, like my Courtney ZZ test patient here, and click on them. And I would be able to assign them a questionnaire. So we will go into here. Our BiTE therapy patient questionnaire is an option. I can click on that. And then I can have a recurring or one time. For the sake of this, we'll just do a one-time survey assignment. And so we will assign it today, February 23rd. And I'll go ahead and hit that. And then a patient at home will be able to see that when they log into their patient portal, they can go into the kind of drop down where it says questionnaires, and there'll be a little green circle that will alert them that they have a questionnaire to complete. I attached a separate video that shows that patient perspective of logging in on a cell phone, specifically an iPhone, and kind of what that would look like and how the survey looks. So that is the video that accompanies this one. From there, on our side of things, we can go back to our work list and see that we have selected the ZZ test, Courtney. And you can see when a questionnaire was assigned. So it'll show that, just today was assigned. I did complete a questionnaire for some colleagues earlier today to show them this process. So that's why it says that one has already been completed today. And now it says the next due is also today, since we just assigned that new one. And then you can put the phone number and email of the provider of the patient in there so that, you can see where those surveys are getting sent to. People can access them, like I said, on their computers or on mobile phones, whatever is most convenient. So we can actually go in here on the EquiCare and see what that will look like. So we can go to the patient and go to their questionnaires. So on here, on the BiTE therapy patient questionnaire that I just assigned is next due, so due today. So we can go ahead and start that and walk you guys through what that will look like. So this is the questionnaire patients will be doing at home. Upon discharge from the hospital, we will be sending patients with a vitals kit This will include a blood pressure monitoring cuff. This will include an oral thermometer for them to take their temperature, and it will also include a pulse oximeter for them to track their own pulse ox at home as well. So they will go home with that, and they will also go home with a ICANN screening worksheet. Essentially, we hope that they will do the worksheet and then they will answer these questions on the questionnaire below that I will get into. That worksheet will just allow them to actually write out that sentence and see if we're having issues with handwriting, therefore scoring positively on the ICE score as part of that ICANN's assessment. So starting at the top, we are screening for CRS. So we're hoping they'll use that blood pressure cuff on a daily basis. They'll be educated on proper times and ways to do so at discharge, but they will log that their systolic blood pressure or their top or first number of the blood pressure reading was either greater than 2 or less than 90 millimeters of mercury. Same thing with diastolic, taking that typical definition of what it is to be hypotensive, that 90 over less than 90 over 60. That's what we're hoping to screen for. And that would obviously be a grade 2 or above CRS. That would positively grade on this survey. And then oral temperature, looking for them to be febrile in any way or hypoxic in any way. So they will go through. So for the sake of this, we will say that, they had a good blood pressure reading, so they're greater than both those. But let's say they were running a fever, which we know the majority of BiTE therapy patients will have some sort of grade 1 CRS symptom. So the majority of patients, I'm sure, will have a similar survey at some points. We'll say, blood pressure is okay, oral temperature is high, so greater than 100.4, oxygen saturation we'll say is greater than 90, so they're doing okay. And then we'll screen them for that ICE assessment, and part of their ICANS score. We're able to identify, today's month, date, year, city you live. We'll say yes. We could name and identify 3 objects near us. We could show 2 fingers. We were able to write handwrite a sentence, and we were able to count backwards from 100 by 10s, 90, 80, 70, 60, 50, 40, 30, 10, 20, 10, and 0. So we'll hit yes on all of those. We'll say we didn't really have any new symptoms, but if they don't have any of these, they don't have to answer anything. If they had something else, they could spell it out. And I listed some examples. Have you experienced any new signs of infection? We'll just say yes, because we were having some chills with that fever. So we will just spell that out here. And then we have some adherence questions. So we know that patients should be on some form of PJP prophylaxis. So we'll say that we've been good and we have not missed any doses, but we could use some refills. Same thing with the acyclovir, since those prescriptions were likely sent at the same time. And then we will go ahead and submit that. Now, we have set up a really nice scoring system. So now this will be what the patient sees. It says, thank you for completing the questionnaire. And then it directs them to please call your medical oncologist primary nurse for instructions on how to manage your fever. Now, if we would have been hypotensive, it would say on how to manage your low blood pressure. If we would have been hypoxic, it would have said for instructions on how to manage your low oxygen level. And then we did say if after hours to please call our medical oncologist on call. And that's just the operator at Munson that will direct them there. So we will hit finished. Now, from an administrative standpoint, I can go into my work list, BiTE therapy patient surveys. I'll be checking this on a daily basis when we have BiTE patients currently on treatment, but basically it will say that Courtney took and completed a questionnaire today. Let's go into that questionnaire and see what she scored on. So I can see it was last completed today, and look, the result is, she was febrile. If I want to look at exactly what she answered, I can pull up her survey here and I can see on the scoring up top. So I have grade 2 or greater CRS. This could be hypotensive, hypoxic, and then any grade ICANS. These are set up as alerts. So I will get an alert that she was febrile, and then hopefully she'll be reaching out for next steps in her treatment. And so, therefore, then we can guide her to either, say she's been having a fever for hours now and, she's already taken some Tylenol, we can bring her into clinic the next morning, give her some fluids if she's dehydrated, or see what else we can do for her. And it will hopefully prevent unnecessary ER visits with all of this as well. So that's kind of the survey system we've set up. Um, and that is hopefully how we'll be able to keep track of patients who are at home, and still be able to keep a close eye on them symptom wise. So that is pretty much everything I wanted to walk you guys through. Hopefully, um, that was helpful, and we just really appreciate all of your consideration for Cowell Family Cancer Center earning the Innovator Award this year for the implementation of our BiTE program, specifically, um, especially with this utilization of our outpatient questionnaire system to closely monitor these patients who we know can have these prolonged or delayed cytokine release syndrome symptoms or ICANS symptoms. So thank you so much for your consideration.